Good morning. Thank you all for being here today. I want to thank the people of Mississippi. I want to thank you for your strength. I want to thank you for your courage. I want to thank you for your perseverance. I want to thank you not on my behalf, but on behalf of your neighbors, on behalf of those who are most vulnerable to this disease, on behalf of your fellow Mississippians. Your work over these last several weeks since the threat of COVID-19 hit our doors has been heroic. You have saved lives. Every hour you stayed home. Every time you used common sense. Every gathering you've missed. Every sacrifice you've made, you have saved lives. The lives of people you know and people you care about. I've struggled to come up with the words to describe how hard this is for our people. To say it isn't easy understates the true cost. Our country has never operated like this before. This is truly an unprecedented challenge. I know that we are not just facing a public health crisis. We are looking in the eyes of the greatest economic crisis in our memories. Not because our economy failed like back in 2007 and 2008, but because of a deadly, contagious pandemic unleashed from China. Some people hear us talk about the economic cost and think of Wall Street hedge funds, millionaires missing bonuses. That's simply not the case here. The stock market will be just fine. It will recover. The burden is being shouldered by working class Mississippians, the service industry, retail workers, restaurant and manufacturing employees, small family-owned businesses. Those are the people without income for weeks. That's not fair, and that's not right. We're watching a national experiment in how effectively the government can replace a paycheck from a business. One thing is crystal clear. There is no replacement for paid work. There's no replacement for providing for yourself and your family. It's just not efficient, nor is it fair on this scale. Across the country, people can't get through to apply. They can't get answers when they try. The funds are running dry quicker than anyone ever imagined. Everyone is surging up to try to meet the increase. We've doubled and redoubled again our capacity, but still cannot keep up with the demand. We've pumped trillions into our economy, and still many small businesses are about to fold, unfortunately, forever. This is not a sustainable position long term. I want it to end as quickly as it possibly can. We also saw our largest number of increases in COVID-19 cases this week. We saw about 270 yesterday. There were about 270 the day before. The curve is flattening, which is good news. It makes our peak lower. It also extends our time at the top of the curve. We are at the worst, hardest, most difficult point in the curve. You've all seen that I did not rush into this because I know we cannot do this for long. I wanted to come here today and believe 2 weeks ago that I definitely would be able to and announce that we can all ease up and reopen. But we can't. I know we cannot stay in this position for much longer, but we are still in the eye of the storm. Last night, the White House put out guidance on when they think states should begin to reopen. I hoped and I prayed we would be there based on their metrics. We're just not there yet. These are just guidelines. Governors have the authority to decide what is best for their own states. We're going to take more time to study the guidances and make sure that they make sense given the situation on the ground in Mississippi. I have real questions about this uniform national approach. The President even encouraged me just yesterday to open up as soon as we felt safe. I made a vow to protect the people of Mississippi. I have to do what the best information and wisdom I have tells me to do. Right now, it tells me I have to ask you for one more week. One more week of vigilance. One more week of sheltering in place. It's working. It's working as a temporary tool. It has to work for one more week, and then we can begin to reopen our state. I'm looking at every number. COVID-19 infections, COVID-19 deaths, as well as unemployment figures. And they tell me this is the best course of action at this moment. We need one more week. Then we will be through our peak use of healthcare resources and able to start the process of reopening Mississippi. Remember our goal. We cannot stop the spread of this contagious virus. We can slow it down, and we can get through the worst part of the cycle. We can prevent our healthcare system from being overwhelmed. We are growing more and more confident that we have flattened the curve to the point where victory is within reach. We need one more week to break the back of our enemy. There are a few changes coming to our shelter in place that we hope will help the people of Mississippi to stay safe, both mentally and financially. First, I'm glad to say that I've gotten guidance from our state and local officials that they feel confident they can regulate our lakes and our beaches safely. We can allow them to reopen for individuals to fish or to relax. It's a small thing, but I hope it helps even a bit for people who need to safely get out in the sun for their own sanity. We need to do anything we can to help address the growing depression, isolation, and other mental health issues. That matters. We're also starting to ease the brakes on certain small businesses. Again, I hope we could be at a place where I was announcing a full reopening today. That's just not where we are. We are going to allow drive-through, curbside, or delivery sales by, quote, non-essential, end quote, businesses. Clothing stores, florists, or athletic goods can do safe sales. If a salon or other business wants to safely sell their excess supplies to stay afloat, they can do that. Call ahead or order online, then safely pick it up. Now, they have to follow strict health guidelines, but they can have some sales while meeting that standard. Here's why. One, everyone is crowding big box retailers. I wish this wasn't true, but we know not everyone is just buying groceries or medical supplies. That's just a reality. If we can allow Mississippi small businesses to do sales in a safe way, we can get some of those people out of the Walmart. We can spread out more. We can actually make more people more safe. Two, I have a fundamental problem with the government making it illegal for people to fend for themselves in a crisis like this. This situation truly goes against all of my instincts. I cannot sit by while Mississippians are driven into poverty without doing everything in my power to give them some greater ability to take care of themselves. Now, I wish I could open it all back up for everyone. I cannot do that without harming even more people, but we do believe we can safely do this. It's not enough, but it's a good faith step towards recovery, and I hope that you will take it as a lifeline and a sign of hope. We are heading towards reopening. It's coming soon. There is light at the end of this tunnel, and we are almost there. Please know your work is having an impact. You are keeping your neighbor, your mom, your grandmom safe. Please stay strong. Please stay smart. Use common sense. That's the single best thing you can do. If you are part of a vulnerable population, please stay home. Please, this is the time to be most vigilant. I'm asking all of Mississippi, stay in the fight for a little while longer, and we will all come through this together. Thank you to Dr. Dobbs and his team. They have been great partners in this very challenging time, and so at this time I'm going to ask Dr. Dobbs to give us an update on where we find ourselves today.
Good morning. Thank you, Governor. And once again, thank you for your strong leadership on all these related issues. As far as updates for the day, as far as new cases reported as of through last evening, we have 169 new cases that will be reported on our website today, with 11 additional deaths. We have 67 confirmed outbreaks in long-term care settings. This brings us to a total of 3,793 cases with 140 deaths, unfortunately. Additional information that you'll see on our website today is we will start breaking down by county, race and ethnicity for each of the counties, so that'll be something that should be available to you in the very, very near future. If we talk about what our hospital situation is, we currently have 148 individuals in ICU with COVID. We have 296 open ICU beds, 95 patients with COVID who are on mechanical ventilation, and then 671 available ventilators. Although we feel pretty strong about our position statewide in the number of ICU beds and ventilators, we still are having some challenges with protective equipment, so that's something we'll continue to work with, and certainly Director Michelle's been absolutely fantastic and his team in trying to procure those much-needed resources. A couple other things I did want to share. We will be doing some testing events over the weekend. Tomorrow there will be a testing event in Quitman County and also JSU here in Hinds County. If you have symptoms of COVID or think you might have COVID, I encourage you to download the C-Spire Health app or call 601-496-7200 to schedule an appointment with one of these drive-through clinics where you really want to test as many people as possible. Also, we have 146 local, private, and community health center clinics that are offering testing throughout the state. That's more than one for every county, and that's available on our website. So please go to healthyms.com/COVID-19 for information on where you can get testing in your community through a local provider. A couple of other quick things that are worth noting. We're really excited that University of Mississippi Medical Center is going to be conducting clinical trials for the treatment of COVID. They have multiple trials going on across the spectrum of disease. If someone is in need of hospitalization or is hospitalized and they might benefit from a clinical trial, UMC strongly encourages them to try to get them enrolled and call the MedCom line. The MedCom line is something that they have access to and can arrange for those transfers. The last thing I would like to mention is one of the potential treatment options for COVID-19 is plasma therapy from people who have been infected previously. So if you have been infected with COVID, have recovered, and are a healthy individual, strongly encourage you to contact the Red Cross or go to the Red Cross website where you can enroll to donate plasma that may save a life. So please, if you're an individual who's had COVID and are healthy and have recovered, this is something that may save some of your neighbors. So please look into it. And that's all I have today, Governor. Thank you.
Thank you, Dr. Dobbs. Director Michelle is here today to talk about the Mississippi Emergency Management Agency and all that they are doing right now. Obviously, we had very, very large tornadoes hit Mississippi on Easter Sunday. I'm happy to tell you that the Secretary of Homeland Security, Secretary Chad Wolf, will be in Mississippi today. We will be touring the damage. As you may be aware, the tornado that hit in South Mississippi between Bassfield and Jones County now has been confirmed by the National Weather Service as the widest tornado in Mississippi history and the third widest tornado in American history, and the damage is horrific. I appreciate the Secretary for his willingness to come and see for himself, and I particularly appreciate President Trump. I had the opportunity yesterday to personally ask him for the immediate emergency declaration, which he approved, and we got the word within hours last night that Mississippi had received that, which means individual assistance for many Mississippians that were the hardest hit. This is a big, big deal, and I am so appreciative of President Trump and his team for stepping up and doing that. This is unusual to have an immediate emergency declaration, but I'll let Director Michelle talk about it.
Thank you, Governor. As the Governor said, this was a horrific storm. Our death toll currently, as of today, is 14 deaths as a result of these storms. As the Governor already mentioned to you, the National Weather Service is still conducting their assessments on these storms, and they're turning out to be much greater in damage and magnitude than we had even initially thought. So far, with about 25% of damage assessments being conducted across the state, and keep in mind we've got about 20 counties that have been affected by these storms. We've got over 300 homes destroyed, 346 plus homes with major damage. Total of, as of yesterday, 1,446 homes affected, and those numbers will definitely grow exponentially as damage assessments are completed. Keep in mind, many of these counties are still cutting roads away and clearing ways. The utilities are still being power in the process of being put back on, so in some cases damage assessments will be delayed for several days before that's started or been able to begin. 102 as of today that are in Red Cross lodging, that people that are displaced. So they are being tracked very closely to make sure that their long-term needs will be met should that case be. With regard to PPE and the COVID, we're still having to maintain that disaster as well. PPE, although we are still very short on PPE, we're a lot more comfortable now with our PPE stockage than we were the same time a week ago. So we are getting PPE in. One of the things that we are looking at long term is we're starting to look at replacing the state stockpile of PPE in hopes that we don't have to use it. But should we have another resurgence in the flu season, as we have talked about before, we want to make sure that we do have a state stockpile to respond to that. So we're looking at that now. County deliveries continue to be robust. We're putting those out every day. And then just to give you an update, yesterday for the Tier 1 facilities, we made deliveries to 40 facilities. So that's a brief update, Governor, on what we got going on.
Thank you, Director Michelle, and I appreciate both of these gentlemen and their teams and literally hundreds, if not thousands and thousands of Mississippi workers working around the clock. Now, this has been a 7-day-a-week job, certainly since the middle of January, but particularly over the last 6 weeks. And I can't thank their teams enough for what they are doing. They're making me proud to be a Mississippian. So with that, I'll try any questions. Courtney?
Yesterday, you tweeted about that 14,000% increase with unemployment. You mentioned a couple of days ago, I don't think those numbers will improve till we can reopen the economy. How difficult, so you spoke to some of it, but how difficult is weighing that and wondering what will be of the state's economy when this is all over?
Yeah, it's very difficult. It is, my heart breaks for those 140,000 people who have lost their jobs. It's awful. And when you think about the individuals that have lost their jobs, most of them, if not a large majority, are working for Mississippi small businesses that are struggling to survive. You have people who have literally put their lives into their florist or put their lives into their small business, and with absolutely no revenue, it is really challenging. And look, I mean, as I think about it, and as we had multiple calls with the governors and with the president and the vice president yesterday, you know, I hear a lot of government officials complaining because they've lost their revenue. Well, governments made decisions which led to lost revenues for governments. These individuals didn't make any decisions. They didn't do anything wrong. They don't deserve this. And so it is not that any of us deserve this. It is a horrific event. We literally, in this country, created 23 million jobs since the Great Recession of 2007 and 2008. In the last 3 weeks, we've given it all back. We've lost 23 million jobs in America. So this is not unique to Mississippi. And, I could get up here and argue, well, if you look at the number of people that are unemployed in Mississippi over the last 4 weeks compared to the rest of the nation, we're at about 60% of what they're seeing from a population standpoint. Well, that doesn't mean a damn thing to those 140,000 people who have lost their jobs. And so we have to do everything we can to get our economy back open as soon as it's safe. And I can promise you, I want to be sitting here this morning saying, Monday morning we're rocking and rolling again, but we're just not quite there yet.
As a quick follow-up, the 1 week time frame, and this might go to Dr. Dobbs as well, but the 1 week time frame, people at home may be saying, well, what difference is 1 week going to make? I know the models have shifted back and forth, but is that really to help get us past that peak?
I don't think there's any doubt about that. As we've had many conversations over the last 3 or 4 days, what we are continuing to look at is the fact that we are right in what we believe to be the middle of that peak with respect to the fact that we did 270 cases yesterday, 270 cases the day before. Those are probably two of the most number of new cases. And now keep in mind, as has always been the case throughout this process, we literally, we know that new cases on a daily basis are not the only thing that you can look at, because a lot of that is dependent upon testing and lab results and when we actually get them back. We are also tracking, which is critically important, which is the onset of new symptoms and when that actually occurs. And what we're finding there is we are looking, what we are doing is working. What we are doing is having a major impact in slowing the curve. It is the reason that we are becoming increasingly more confident that we're not going to overstress our healthcare system. When I sat here 10 days ago or 2 weeks ago, obviously when we announced the system of care with Dr. Clay Hayes and Dr. Brunson and the State Health Department, we literally really believed that we were going to have to institute some of those contingency plans. Those seem less likely now. They're still in place. If we have to do it, we will do it. But what we are doing is working and in slowing the spread of the virus, in protecting our healthcare system. Dr. Dobbs, you want to?
Yes, sir. Thank you. One thing I think it's important to sort of acknowledge is that it's only a week, but it's a 50% increase over the previous. So, a lot's happened over the last couple of weeks, and an additional week will kind of help us get on the backside of that. And then after this additional week, it's not like we're going back to total business as usual, right? Because the school buildings are going to be closed, and there's going to be other, social distancing stuff almost certainly that we're going to want to maintain. And those things are actually very impactful. Shelter in place is really a phrase more than a necessarily an exact thing. And I think all the stuff that Mississippians have done to do proper social distancing, whether it's masks or staying at home or maintaining proper distancing from individuals when you're out and about, all of that stuff is very, very impactful. So please continue those things no matter, at least for the foreseeable future, whether or not we're under this shelter-in-place sort of guidance.
Yeah, and what I will tell you also is, as you've heard me talk this entire week, we moved into the shelter-in-place in phases, and we're going to move out of it in phases as well. And so I would certainly suggest that allowing what were defined as non-essential businesses to offer curbside sales is a step. It's a minor step, but it is a step in the right direction. And we are hopeful that will help some Mississippi small businesses get through the other side of this. Yes, ma'am?
Can you just elaborate a little bit on those non-essential businesses? I know we're going to get a lot of questions about just specifics.
Yeah, so let me first of all say that, and no one in politics likes to admit a mistake, but to a certain extent, I think in this country, when we started defining essential and non-essential businesses, we made a mistake, because I can guarantee you the people who work and the people who own those non-essential businesses, well, they're pretty daggum essential to those individuals. And so we did it so as to protect from irrational government overreach at the local level. We named essential businesses, and that would not have happened in 99% of Mississippi's governments, but in some it may have. But in terms of the non-essential businesses that will now be able to reopen, think about a local florist, for instance. If I have a florist that has less than 10 employees and I can open my doors now and answer the phone when my neighbors call and say, hey, I want to deliver a flower arrangement to my neighbor. Would you allow me to just drive through? This is what I want. You bring it out to my car, give it to me, and move on. That's perfectly safe. We believe you're not putting more people in danger. In fact, if that person had gone to a big box retailer with 300 people in that particular space, well, it very well may be that they're in significant less risk by going to a small place. Other retail operations, and in essence, the way in which we did it, and once we're able to get you the actual EO, we just expanded what non-essential businesses could do. You may recall in the previous executive order, which allowed for shelter in place, we were pretty specific in saying that even non-essential businesses had the ability to go to work, they had the ability to keep their payroll systems running, they had the ability to do a lot of things. They just couldn't let large crowds come into their retail shops. Well, this allows them to sell goods and services as long as they do it in a safe, responsible way. We've also made sure that the social distancing requirements and the restrictions of gatherings of persons of 10 or more, et cetera, are still in effect for these businesses should they choose to reopen on Monday morning. Yes, ma'am?
Now, Governor, I know you guys are playing it all by ear, but do you guys have anything in place if things don't go as you hope during this 1 week or even after this 1 week?
Well, we're certainly putting contingency plans in place. We've spent weeks and weeks putting plans in place with respect to our healthcare system. If something were to spike, we will sit down and make a decision at that time. I will tell you what it appears to me, and this is an interesting part of this whole conversation, is by approaching this in a methodical, data-driven approach, there is no question that we have significantly reduced the size and the height of our peak. When you look at the models, many of the models were projecting 10 times the number of fatalities in Mississippi just 2.5 weeks ago. They were projecting significantly more new cases. We have slowed down that height of that peak, but it also, because I think we've done many things right, certainly not everything, but we've done many things right, the time at which we're going to stay at our current peak is probably going to be a little longer than it otherwise would have. If you look at one of the other states out there, if their curve does like this, well, they stay at the top for a fairly short period of time and they get over it. Now, they put significant stress on their healthcare system, and I think more people are harmed, but if you have a very slow, lower peak to the curve, you protect more lives, you protect more Mississippians, but you sort of stay at that. It's more of a plateau than it is a peak. And so I think we're going to be at that plateau for several days. But as we've seen, the numbers are going to jump around because it's driven largely by testing. The other thing I'll tell you, which I've said repeatedly, if you look at the states in America that have done basically their own testing and have ramped up at local labs, have ramped up at the state lab, have ramped up at their research universities, have ramped up at University Medical Center, and you look at the number of people that we have tested and compare us to all the other states that didn't have significant federal resources flowing in, we have tested an incredible number of Mississippians, and we're going to continue to do that, and we're looking for ways to continue to increase testing capacity. Yes, ma'am.
Nick from Jackson Free Press has a question.
Great.
Hi there. This is a question for both Governor Reeves and Dr. Dobbs, and it's a multi-part question, so I apologize for that. What mechanism do we plan to use to keep the curve from rising again? For example, is there a new phase of contact tracing? Are we beginning antibody testing? essentially what I'm asking is, why won't we just be back here in another few weeks? And the second part of that is, what is the specific number of cases or the general trajectory of cases that would lead us to return to stricter controls?
Well, I'll start the answer, and then I'll turn it over to Dr. Dobbs as well. We are doing significant amounts of contact tracing, of working. We have built up significant additional capacity at the State Department of Health since we began this process several months ago, which seems like several decades ago. We will continue to increase our testing capacity. I think it's likely that we're going to continue to see new cases in our state. As we have said repeatedly, our goal from the beginning has been to slow the spread of the virus such that we protect the integrity of our healthcare system, knowing that that we were trying not to find ourselves in a position like occurred in New York City and is now occurring in New Jersey and occurred in the city of New Orleans just literally a couple of weeks ago.
Thank you, Governor. There's several things that we are going to be doing. We are going to be adding antibody testing. It's a service that we're going to start bringing on in our lab. I know that UMC is adding that capability too, and a lot of other places. Antibody testing has a unique role, and I just do want to reiterate that it's not really for diagnosing acute infections. It's really more for determining prior infection. That will have an important role. I just want everybody to know you just can't go in and get an antibody test to see if you're infected now. That could be misleading. That will be layered on to our current contact and investigation and isolation quarantine work. We will layer on additional support, whether that's going to be electronic. We're doing additional sort of automated electronic communications. As we kind of go through this, there'll be more and more that we'll make that system even more robust. As far as looking at monitoring the potential resurgence, and that's a real concern. If you look at our historical trends, though, some of the essential social distancing stuff and the awareness as people have taken on their own has actually been very, very impactful. We've changed our lives in remarkable ways, and that makes a big difference. So I don't think that's going to change abruptly. We're not going to go back to the way we were 3 months ago. But we are looking at specific metrics of new infection by county, and that way we can sort of monitor quickly if a county is seeing a decline in new cases or if they're seeing an increase. And this can be a local phenomenon. What happens locally may be really important, and probably this isn't a sledgehammer thing. Hopefully, it's going to be a little bit more of a scalpel sort of thing, such that if we are seeing a resurgence in an area, we can act locally instead of sort of like dropping the hammer on the whole state.
And let me just reiterate, as we go through the next 6 to 7 days and make decisions on where we go from here, we are looking not only in terms of types of businesses that we can potentially reopen on a statewide basis. We're also looking at regions of the state that we can open back. We're looking on a county-by-county basis, which is a recommendation certainly that we discussed in the call with the White House with President Trump yesterday. And there are wide variations right now in terms of number of cases per capita from county to county, even in Mississippi. And so we believe if we can get through this next week, we have some real opportunities to go back to where we found ourselves just 2 weeks ago. And keep in mind, even if we had completely taken the shelter in place off today, which was not where we believed was in the best interest of the citizens of Mississippi, but even had we done that, it would not have eliminated our executive order, which required social distancing, which eliminated gatherings for social purposes of groups of 10 or more. And so I think there is a difference in how do we get our economy back rolling again by opening businesses and by individuals actually participating in those businesses, and going back to normal of 6 months ago when everyone was attending large funerals and large weddings, etc. We're still a ways from actually getting back to, quote, life as it existed before this pandemic. Yes, ma'am?
Are there any talks about having people wear masks, like a requirement or order to have people wear them? As you know, a lot of people are starting to use them.
Yeah, I'll let Dr. Dobbs, I think he has given recommendations. I think CDC has given recommendations that you should wear a mask in public. Is that correct?
Yeah, absolutely. You know, we do strongly recommend people wear masks in public, you know, especially if, you know, if you're going to be around different folks. If you're out shopping, it's so important. We know that it actually, evidence is showing more efficacy than I think was previously believed. As far as like a legal order, I'm not sure that's in the works. I mean, that's kind of hard to implement, but it's also, it might actually be extra difficult for people who don't have access to resources like that. So certainly we're working to try to work the other side, the supply side, so that people have access to it. We're trying to get some community masks manufactured in Mississippi out to local folks so that they can use them. But really just strongly encourage everyone to use a mask when they're out in public, and then especially if you're shopping, you know, going to the grocery store, that sort of thing, because sometimes it's impossible to maintain strict social distancing in some of those scenarios. So please do it.
Yeah, I think I want to reiterate, particularly if you're in a vulnerable population, but for all Mississippians, stay home. But if you have to get out for what we define as essential travel, and shopping in these small businesses is now allowable under the essential travel exception, wear a mask. Please wear a mask. I look around this room, and there's not a lot of people here, but there 3/4 to 4/5 of you have on a mask, and I think that's good. Both of these gentlemen have masks with them, and so I think that if at all possible, please wear a mask. Yes, sir.
Yes. Have you been in contact with the Department of Corrections, and have y'all been talking about possible compassionate release for at-risk or elderly prisoners?
Yes, we have had multiple conversations with the Department of Corrections over the last, since the day I took office. We've had multiple conversations every day with the Department of Corrections. It's been a constant. Obviously, as we move through this, we've worked really hard to minimize the risk. We were very, very early in eliminating any visitations to our correctional facilities, et cetera. We have had conversations about early releases, and we have not made the decision to do that at this point in time, but those conversations are ongoing. Yes, ma'am.
Taylor from Daily Journal has a question.
Good.
Taylor?
Thank you, Governor. Can you hear me?
I can.
Okay. My question is two parts. The first one is, as you know, the state is set to receive around $1.2 billion from the CARES Act. Have you thought about how you would spend those funds? And I know there's some constraints on how you can spend the money, but the second part of the question, relates to that, is in order for local governments to receive direct payments from the CARES Act, they must have a population that exceeds 500,000 people, and I don't think that there's any county or city in the state that exceeds a population of 500,000. So do you have any plans to assist local governments through the funds that the state will receive?
Yeah, well thank you, Taylor. I appreciate those questions, and the short answer to your initial question is yes, we have spent time thinking about what makes the most sense in terms of how we would utilize those discretionary dollars in the CARES Act. What we have done is we have set up a private sector group that we had our first call yesterday. They're having an expanded call today, I am told. I'm going to be traveling with the Secretary and unable to join them. But we put together a group of Mississippi's best and brightest minds to look at ways in which to restart our economy. And those are resources that we could potentially utilize to help get people back to work. Everything from workforce training to workforce development and other programs that may need to be implemented to help the people of Mississippi. There are certainly a lot of local governments that have and will continue to experience revenue losses. And what I would tell you is we want to do everything in our power to help those individual local governments, but the CARES Act explicitly says these dollars cannot be used for revenue losses for governments. That's true of state government, and that's true of local governments. And so I think there's a lot of great, many of our great leaders at our cities and counties believe that we'll be able to put together a program to help out with revenue losses, and we may be able to. We're looking at every option, but the utilization of that $1.25 billion from the CARES Act, my lawyers tell me, and quite frankly, we were on a governor's call last night, everybody's lawyers say it is very explicit that making up revenue losses is not the purpose of those monies, and therefore there is conversations ongoing in the Congress right now between the leadership in the House and the Senate about the potential for additional resources for governments, particularly from a revenue loss standpoint, and we'll see where that goes. But the CARES Act is not monies that can be utilized for that, because the federal guidelines specifically say you can't in the statute. Now, we expect the Department of Treasury to produce guidelines on what we can spend those monies on sometime within the next 10 days to 2 weeks. And once we get those, we'll better be able to outline our approach and what we're going to attempt to utilize those funds for. But I will tell you, I am very interested in helping Mississippi workers that have been displaced from their jobs, and I'm very interested in helping revive our economy. Yes, ma'am.
Just as you had many questions about fishing early on when the lakes and beaches and everything closed, I'm already getting lots of questions. People saying, will they be able to open the beaches and lakes immediately, or would that be after Monday? I don't know the specifics of the order.
It'll be after Monday. Okay. Yeah, it'll be after Monday. And just so everyone knows, we've had a number of conversations with, for instance, the reservoir, which clearly in your viewing area is very important. And so there will be a few boat ramps that are still closed at the Pearl River Valley Water Supply District. They are not going to open their parks, for instance, and so there's a few boat ramps that will not be open inside their parks, but there will be many, many boat ramps that are open. And so what we're looking to do is we're allowing for fishing, and so individuals who are in a fishing boat that have 2 people in them, that's perfectly acceptable. If you want to get in another boat for recreation, what we are requiring is that you have less than half of the total allowed number of people in that boat. So if you have a boat that allows for 12 people, then what the order allows for is no more than 6 in there. That seems to be a way in which to ensure that social distancing continues, that we're not putting significant additional people at risk.
Jack from Clarion Ledger has a question. Jack.
Morning, Jack.
Hey, good morning. So the guidelines released by the president urge states not to lift stay-at-home orders until they reach a 2-week period in which the number of coronavirus cases is declining. You yourself mentioned a little bit earlier that we are this week experiencing the highest numbers of new coronavirus cases that we've seen. So how are we, I guess, going to maybe lift this lockdown a week from now if the Trump guidelines call for 2 weeks of declining cases?
It's a good question, Jack. I appreciate that. And what I would tell you is these are just guidelines. If you read throughout the entire guidelines, it is very, very clear that every governor has the discretion to understand what's on the ground and what's happening on the ground. We'll have many conversations with our head of State Department of Health and otherwise. But the key point here is if you look throughout those guidelines, it also makes exceptions in virtually every single page for those states and specifically those counties and areas where there are not significant outbreaks and where there is not significant community spread. And so we'll be taking all of that into account because if you simply look at that particular piece of the guideline, and there's actually a 3-step process, but if you just look at that particular piece, it actually would have argued for a really big spike really quickly, which then turned around. And that's not at all the way in which we approached this virus, and I think we approached it the right way. I don't think we wanted to have a New Orleans type quick spike or a New York City type quick spike. We wanted to minimize the height of our curve, which by necessity may lead to a longer plateau at that level, which puts us at a bit of a disadvantage if you only look at the specifics of that particular guidance that was put forth yesterday. Yes.
Getting some questions. I believe that early on you mentioned salons when you were talking about non-essential businesses. Specifically, would that mean that they could have one or two individuals inside, or would it still be some type of like, here's your shampoo that you can pick up beside the salon?
In terms of salons, it would be, I got a call the other day, or my team did, from a salon that sells products, shampoo obviously, but also they sold hand sanitizer. And they had acquired a significant amount of hand sanitizer, but under the previous shelter in place, they couldn't even sell that. And so what they could do is they could open up, they could curbside sell things to individuals that called ahead. You could bring it out to them and give it to them. But the new EO will not allow for individuals coming in and out of those salons for one more week. Yes, ma'am.
Going back to the Mississippi State prisons, I know that we've been getting a lot of people saying that they haven't received masks in there, they haven't received any proper sanitizer or anything like that for them. You said that you were still having talks with MDOC, but is there going to be a step to make sure that they're being taken care of? Because I know that there have been 4 positive cases throughout the prison.
Right. Yeah. My understanding, the last time I spoke, is that the Department of Corrections and the Mississippi Emergency Management Agency had been in contact, and I believe we actually sent significant amounts of materials up there. I don't know if you know any specifics about that, Greg, or not. But
I don't have any specifics, but I do know that we are making deliveries to state agencies. Now that we're getting more PPE, and MDOC was one of those.
Anita from Sun Herald has a question.
Okay.
Anita?
Thank you. Governor Reeves, I just wanted to first clarify something and then ask a question of Dr. Dobbs. The relaxing of the rules for businesses and beaches, I was assuming those would go into effect after the current order expires at 8 a.m. Monday.
correct.
But you just said after, they would go into effect after Monday. So specifically, when do these orders go into effect? And then I'm hoping Dr. Dobbs can give us some details on contact tracing, such as how many teams we have doing contact tracing, how many people have been employed in this effort, how many the state hopes to employ, what parts of the state is this being done in, and under what circumstances are we doing contact tracing. I've been unable to get an interview on this regard, so I'm hoping we can get some details rather than just broad comments about contact tracing. Thank you.
Thank you. The answer to your first question is the new order goes into effect at 8 a.m. on Monday morning.
And thank you. I'm very happy to talk about contact tracing. This is something that we do routinely around other disease processes. This is obviously just at a much grander scale. What it involves is when you identify someone who's a case, we will contact the individual, do an interview, get all the information we need, both for data surveillance, but also too for information or contact tracing. That person is placed on a legally binding isolation order for the duration of their contagious period, which is essentially going to be 14 days from the start of symptoms. From that point on, we do interview contacts, and close contact is essentially anyone who has spent 10 to 30 minutes without protective equipment within 6 feet of that person. So that can be sometimes a significant number of people, but a lot of times it will be family members, and then those individuals are therefore contacted and then placed on quarantine orders for the duration of their or of their potential incubation period, so that they don't then have a second wave of infection. We do then have a secondary response team that if folks are out of compliance, we do some reinforcement, and of that there are legally punitive measures, including fines and jail time, although we haven't had to implement any of that sort of thing. And then as we go forward, we've been able to contact, essentially everyone since we started this effort in earnest. We have over 150 people devoted to this effort. They're pretty much situated in the previous 9 public health districts. And so they're scattered throughout the state, and a lot of it's dependent, the staffing's based on the disease burden, so that they can have adequate time to do thorough investigations. If you have 150 people and you have 150 cases, you have a time to be pretty thorough. And so we'll continue to add additional staff as we need to kind of go in the effort. Most of the people we've pulled from a previous work like tuberculosis, nurses who have experience with this, disease investigation specialists that we have for other purposes, for HIV, syphilis, and that sort of thing. That's been our primary approach, and then hopefully we will continue to do more aggressive things with our contact tracing and our isolation work, but I hate to give it away until we have it all in place. I don't want y'all getting too excited.
Yes, ma'am.
I have a question for you, Dr. Dobbs. Can you talk more, I know you mentioned earlier, encouraging people who have recovered from the virus to donate plasma. Can you talk about how that will benefit and help save lives?
Yeah, so people who have had coronavirus, after they recover, they'll have protective antibodies in their blood. And this is something, this is basically serum therapy that's been a potential treatment for a long, long time. And basically what'll happen is you can donate your blood, and then from your blood they extract these protective antibodies, and then we'll take these antibodies and give them to someone who's acutely ill. So basically they're using your immune system, your immune capabilities to fight for somebody else. And it's still experimental, but there are lots of reasons to think that it could be very helpful. And so really would encourage people to contact Red Cross. If you go on the website, they have a form you fill out, and you can go through the different details, and then they'll contact you to set up a location where you can donate. Also want people to donate blood. Certainly hospitals need blood. That's still something we very much need to do. I know we have less blood drives, but still blood donation is very important for our healthcare system.
Yes, sir.
For Dr. Dobbs. So as far as the curve goes, where are we in the curve right now? Or have we reached a point where we're starting to overwhelm the healthcare system at all?
As far as where we're on the curve, it's always such a tough question because you don't know until 2 weeks later. But if we're probably on the plateau, whether we're in the middle of the plateau or in the backside of the plateau. I think that's a great description. It's hard to say. We're hopeful that we're on the backside of it. We have some indicators that could possibly be the case. As far as healthcare utilization, we probably are like smack dab in the middle unless it gets worse for some reason. We do have adequate intensive care units. We have adequate ventilator capacity. Still, protective equipment still is really a challenge. That's probably our biggest limitation, and has been the whole time because it's all been, ventilators, those stay forever, right? I mean, they don't just break, but these reusable things like testing equipment and then test tubes and PPE, those have been really resource issues because fortunately we haven't been a priority location for the country. We don't want to be. But so all of those equipment, the necessary equipment has been basically sucked away to places that have greater need.
Renee?
WLOX has a question.
Good.
Governor, Dave Elliott here. Can you hear me?
I can, Dave. How you doing?
I just need some real clarification. Now, this may not apply to folks up in Tishomingo County, but down here on the coast, this is a big story. You open the beaches as of Monday morning at 8 a.m. You say you talk to local officials. Does that mean Hancock, Harrison, Jackson County boards of supervisors will be in charge? Are the mayors going to be responsible? Can you tell us how that's going to work?
Yes, I can. Thanks, Dave. Appreciate the question. I have spoken to local elected officials in, I think, all 82 counties over the last 3 or 4 weeks. We are going back effective 8 a.m. on Monday, back to exactly where we were 2 weeks ago, Friday, as to who is in charge of the local beaches. One of the things that Dr. Dobbs and I have had many conversations about over the last several days is the mental health of Mississippians and the fact that there are very little risk to Mississippians who are spending time on the beach, as long as they are adhering to social distancing guidelines, as long as they're having less than 10 people in any one group, and as long as they are staying 6 feet apart. I've spoken with a number of the law enforcement entities in various jurisdictions that will be enforcing those guidelines, and we have offered anyone who needs it, we will provide state resources to help police that if that is necessary. As you can imagine, the local law enforcement agencies are very reluctant to ask for that, and that's perfectly fine. But if they need it, we have the ability through the local emergency operations center for our local governments to ask for help doing that, and we will be more than happy to allow them to do it. If a local government that oversees the beach in a local jurisdiction were to decide that they did not want their beaches open, they continue to have the authority to shut those down if that is something that they find as being necessary, or if they believe that they don't have adequate resources to police them. We have not heard that that is the case in any jurisdiction, and so, but again, it is critically important that we don't have large groups gathering and groups of more than 10, or that are not experiencing social distancing.
Nick from Jackson Free Press has another question. Nick?
Hi. Yesterday, the Clarion Ledger reported that none of the 17 people on the Restart Mississippi task force are from organized labor or directly represent Mississippi workers. Why is that, and how will you seek the input of Mississippi's workers moving forward?
Well, I'll just tell you that I am 100% convinced that the people who have agreed to serve on this particular restart effort are totally focused on doing what's right for Mississippians and for those who have been displaced. We don't need union bosses to tell us how to take care of our people. We never have, and we never will in Mississippi.
Jack from Clarion Ledger has another question. Jack?
Hey, actually, Nick just asked my question, so I'm good.
Thank you. Seeing no other questions at this time, I am not going to do birthdays because I've got to go meet the Secretary of Homeland Security. I'm not going to do birthdays right now, but I am committed to continuing to do birthdays as long as this shelter in place is in order. And so we will announce on social media when we're going to do it later this afternoon or late tonight whenever I get back into town. If your birthday was yesterday or today and you want me to wish you a happy birthday, fill out the form because we're going to do it because we think it brings joy to Mississippians in very challenging times. So thank y'all. God bless y'all. And we're going to get through this together. Bye-bye.